It's Tuesday morning, and of course, you know how we do Tuesdays. It's time for health. Favour Ikeoluwa Oyewole is a medical doctor who's passionate about physical health and mental wellness. I like that, physical and mental wellness, because quite a lot. Now, she has worked with various NGOs for healthcare service delivery with emphasis on preventive health. I like this rather than curative. And we'll be talking about breast cancer, identifying the symptoms and early detection, because this is Breast Cancer Awareness Month. Hello, Doc. Good morning. You are welcome to the show.
Thank you. Good morning.
Just before we get into our topic today, I love the emphasis of what you do. You said preventive rather than curative. How important is it for us as humans to think preventively rather than thinking of curatively?
Well, they say that good health is cheaper than cure. So rather than saving your money and then suddenly falling ill and having to spend all those life savings on curing whatever happens, why don't you just spend, just little or even no money to prevent the illness?
Can you give us just a few tips of things that we can do for our general health, being and wellness when it comes to preventive? Just a few.
Okay, health education on a general scale. Just you being aware of how your body works is very key. So like those health education that they taught us, those things they taught us in primary school, secondary school, like wash your hands, like have your bath, brush your teeth, all those things, they don't cost much really, well, besides the school fees, but then they help to go a long way in preventing a lot of diseases. Just you eating right, eating well, and all this would actually like go a long way to preventing sicknesses, or even like you presenting early, or limiting the adverse outcomes that could occur.
Right, wonderful. Now, it's Breast Cancer Awareness Month, and we're talking about early, signs and symptoms. What are the signs that women can look out for when it comes to identifying breast cancer?
Yeah, okay, so breast cancer, although it's predominantly about women, but also seen in men. So breast cancer, men should also be aware of breast cancer, right? Yeah.
Men?
Yes, men.
How?
Statistics shows...
men get breast cancer?
Yes, yeah. Although it's rare, it's less than 1%, but they do get, yes.
How?
Statistics in the United States show that about 2,100 men get breast cancer yearly. Of course, compared to a higher rate.
As much as I'm widely read to, and I would say so,
Yeah.
but this one is shocking to me. So, even men.
Yeah.
So how do we go about detecting early the symptoms? What do we look out for, men and women?
Okay. One of the things we look out for is breast lump, right? So although breast lump is not automatically breast cancer, but it's one of the things that can be detected. So we're still going, if you feel a breast lump in any of your breasts, you're supposed to have like a breast self-examination.
How often should you do this examination?
At least once a month. That one, the self-breast examination.
Okay.
Once a month, especially like 2 to 3 days after your menstrual cycle. Your menstruation, sorry.
Okay. So you can do it, you can perform it on yourself. You don't have to go to the hospital.
You don't have to before you do a breast self-examination.
Oh, okay.
Yes. So.
But is there any process to do it?
Oh, there's a process to do it. Okay. Can I use?
Yes. Oh, yes.
Okay. So like, imagine like this is your breast, the entire breast. So divide it into 4.
Okay.
This is left, right, and then like that. So there are different positions, but you can do it standing. You face the mirror.
Okay.
Depending on the size of the breast, you can try to stabilize. And then feel
for it.
Feel
right?
for a lump. Oh. So you go like that.
Okay.
The
are there some people who are more susceptible to this, maybe based on size, than some other people?
Not based on size.
Not based on
yes,
size. Okay,
well,
so
gender, like female.
Female.
Yes.
Okay, so some people say that if you have bigger, breasts, you are more susceptible. Is that
No.
true?
That's not true.
That's not true.
Yes.
Okay, so that's one myth there
Myth,
that we're
yes,
dispelling.
that's not
Yeah,
true.
that's not true. So it doesn't matter the size. You just have to ensure that you check. And like you said, once a month, right?
Well, obesity is a risk factor.
Obesity is a risk factor.
Yeah.
Okay.
So
Okay.
maybe that might have contributed to the myth.
Okay. Oh, yes.
Obesity,
Yes.
yeah.
Yes. So in some ways, someone could say that, but, man, when the whole the body, increases and all
Yeah.
of that, it also okay.
Yeah.
So that is what. Okay.
Yeah.
So what other things apart from this? Is there any other thing that one can look out for?
Pain, breast pain.
Breast pain.
Breast pain, then some abnormality of the breast. If you notice, like maybe there's a puckering of the breast, dimpling, or bloody discharge, pus, anything that's abnormal.
That's abnormal.
Really. Yes, I think it's important that whenever we find anything abnormal, we should think of the worst. Like if you think of the worst thing that can happen, it
That's why
would
they
probably
Google our symptoms. What you are saying now?
no, it would probably like push you to go to the hospital.
Okay.
At least when you get the
check.
Yes, when the doctor tells you, oh, it's fine, there's nothing to worry about, puts your mind at rest.
At rest, right?
But if there's something, at
Okay.
least you could, detect it early.
There's another myth that people actually talk about, and I read something, and even some doctors, I don't know, some doctors, the doctors are different
Yeah.
about breast cancer, and it is said that if the breasts are sucked and all of that, it helps prevent breast cancer. Is that true?
Yeah, well, lactation has been shown to reduce the risk factor.
Lactation. So that means that when it's from the kid to a...
Yes, well, another thing is suckling of the breasts would include handling the breast.
Okay.
So if the partner can detect any lump or abnormality of the breasts, it would help.
So you're saying
Early
that, I don't know
detection.
why my director, my producer, by the way, Olamide and Zainab, two of you should please. But yeah, it's something that people really need to know. But scientifically, you're saying that it's not, because some people say that it is proven that if that happens, or that it does help in prevention of breast cancer. And I want to be sure if it is scientifically...
Not exactly prevention, just reduces the risk.
Reduces the risk.
Yeah.
Okay. All right. Wonderful. So it's Breast Cancer Awareness Month. Yeah, I know, and I know that some people do different programs where people can go for checks and all of that. Do you know of any that people might want to go for? If they need to check, or do they just go to health centers? Are there programs that happen in health centers where women and even men now, from what you say, can go and check?
Okay.
For this.
I don't know of any, but usually people that are, especially women that are over 35 years, they should take it even more seriously. And every woman should really, as you go older, every woman should take breast examination seriously. But people that are over 35, over 40, should have something called a mammogram.
Yeah.
So mammogram is like an X-ray, like a radiological examination for the breast that would help to detect, to a great extent, breast cancer or abnormalities of the breast, really.
Thank you so much. Thank you so much, Doctor.
You can go to an health center, any of the
that
hospitals. Yeah.
Thank you so much, Doctor. This was quite expository, so I know some people would have gotten some knowledge from what you have given us today. Thank you. All right.